Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Medullary cystic disease. Okay. In medullary cystic disease, here you will see that there is an excretory urography or ultrasonography is present. But when you do an excretory urography or ultrasonography in these patients, they will fail to detect the cysts because these cysts are very small. Because they are small, it is difficult to detect these cysts. These cysts may be seen on the imaging if they are only large enough. So as a result, in early in the disease, these cysts are not visible. Then how are you going to diagnose these medullary cystic disease? So in such case, the medullary cystic disease is mainly diagnosed by the biopsy. In the biopsy, on histology, you will see a characteristic triad is seen. The characteristic triad are: there is irregular thickening and disintegration of the basement membrane is seen, and there is marked tubular atrophy is seen with cyst development, and you will see presence of interstitial cell infiltration with fibrosis is seen. So first important thing about medullary cystic disease is these cysts have to be large enough for diagnosis, or else we cannot, it is very difficult for their diagnosis.
thank you and thank you for watching.